What we really wanted to do was start to unpack the Youth Risk Behavior Survey. So much of what we do is around data and specifically our youth data. And so while we do this, there's a couple of things that are going to happen tonight. We did the welcome and introductions. We're going to look at the YRBS data, and then we're going to look at the Photovoice. And we actually have 3 of the Photovoice students with us, and they're going to share a little bit about their photos when we get to that. And then kind of how do you get involved? You know, we're looking at all this data, and it's going to be clear that we have youth who are using substances to a level that's not acceptable. And really any level is not acceptable, but our levels are concerning. And so as we look at this data, we invite you to think about, what do you see in your community or in your sphere of influence that could help make the situation better? And then we'll share a few ideas at the end as well. Allison will be typing some questions in the chat, kind of thought questions, but feel free to respond to those. But we also want to recognize time-wise that we don't have a lot of time. So you may have questions, and so type those questions in the chat, and if we can get to them, we'll definitely answer them. But if we can't get to them tonight, we're going to copy that chat and we'll do a blog post where we answer those. So without further ado, we're going to look at the data is based on Lamoille County. The state of the Vermont Department of Health does the YRBS, so Youth Risk Behavior Survey, every 2 years. And so these numbers are from 2019, and they're pre-COVID. So, you know, also take that into account as we frame the presentation. So we're going to look at 4 different substances: alcohol, cannabis or marijuana, tobacco, and RX or prescription drugs. And tobacco and cannabis, there's also the subcategory of vaping, because we know that youth are vaping both tobacco as well as cannabis products, or nicotine as well as cannabis. We're going to look at lifetime use, so ever used, age of onset, when did youth report start using, last 30-day use, student perception of their parents' perceptions, so like kind of looking at what did their parents think, and then perception of harm, what do the students think the risk is to them. We're going to look at ease of access, how easy do students think these items are to get, as well as looking at some protective factors at the end. So both, each of one of these has, every slide has youth, middle school data and high school data. It has the 2017 as well as the 2019 for comparison. And it also has the as well as the state of Vermont. So as we look at this, we'll start just kind of read left to right. So when we look at middle school alcohol use, that has gone up a little bit. So 1 in 4 middle schoolers have ever used alcohol from Lamoille County, versus 1 in 5 for the state. So we're 5 percentage points higher. When we look at cannabis or marijuana, we've gone up in that. We're now at 10% have ever used. And this could be just used one time and didn't like it. This doesn't necessarily mean that those students are continuing to use. When we look at tobacco, we're at 7%, which is right in line with the state. And but vaping has increased to 16%, and that has increased at the state level as well. The other thing to note is that this data was collected before the vaping issues related to the vaping deaths as well as the serious lung issues. So, so this data is a little bit older, but it's hot off the press for us. It was slowed down a little bit due to some of the COVID work. And then prescription drugs, we see a big increase here. This is really concerning for middle schoolers. So they were at 1% and they've jumped to 6% of having ever misused a prescription drug. So that's something that we need to, a trend that we need to watch and potentially be addressing as well with some of our messaging. So when we skip over to high school, obviously we see the numbers shoot way up. They've lived more life, but this is super concerning. We know that youth who use substances before the age of 15 are about 40% more likely to develop a substance use dependence issue later in life. So, these are all going to be concerning numbers and are risk factors for later problems as well. So alcohol use, we're looking at 60% versus the state's 55%. Cannabis use has gone up by 3 percentage points. So we're at 45%, again, higher than the state's 40. Tobacco, the questions did change related to tobacco. It was ever smoked a whole cigarette to ever tried a cigarette. So, so these, the 2017 to the 2019 numbers aren't necessarily apples to apples comparison. It's a much bigger commitment to smoke a whole cigarette versus ever tried, although still concerning. And then vaping, we see a large jump here as well, from 37% to 54%. And you're going to see some vaping trends throughout the data. Prescription pain medicines, ever misused of that is 9%. Which is consistent with the state, but again, it's way too high. Misused RX stimulant is at 6%. And then the lifetime ever use, this is the only category that they give us data for cocaine, inhalants, and heroin or meth. But cocaine has 5%, inhalants is 9%, and cocaine or meth is 2%. And those are, the inhalants is a little bit higher than the state, but there's potentially some work on education that can be done there. So now we look at age of onset, and this is where it gets particularly concerning. We often think of, it's those high schoolers that are experimenting or trying substances, but it really starts much younger than that, which means our conversations in the community and education to parents needs to start at a much younger age. So middle schoolers, the data was not available in 2017. They didn't ask these questions of around age of onset, but they did in 2019. And they asked before age 11 for the middle school one. So these numbers are definitely concerning when we look at their potential for lifelong impacts and dependency. So for alcohol, 9% of middle schoolers had tried alcohol before the age of 11. Cannabis, 2%, tobacco, 2%. And they didn't ask that question regarding vaping, but RX was too few to count. So, and then when we skip over to high school, this is actually an encouraging trend. In 2017, it was at 20%. So 1 in 5 students had misused or used alcohol before the age of 13, and that's dropped to 16%. So that's actually an encouraging trend. That's moving in the right direction. Still a lot of work to be done there, but it's encouraging, and we're still higher than the state there. Cannabis use, 8% versus the state's 6%, and tobacco was 9% had used before the age of 13. And then when you start to think about lung impacts, that's concerning. And then, so then as we skip over to last 30-day use, welcome Michelle, she's joining us. So when we look at last 30-day use, this gives us current trends. The other 2 numbers were related to ever used, and now this is used recently. So 9% have used alcohol, and which is still higher than the state. And then 3% of middle schoolers report binging on alcohol, which is depending on gender, 4 to 5 drinks in one sitting. Cannabis use has gone up from 5% to 8% for middle schoolers. And we have suspicions that is the changing culture as we start talking about legalization, and we start to talk about legalization and you know, commercialization. That really does impact that. And Betsy, that was a really good question. That's why I got delayed. She asked what percentage of youth, local youth, take this survey, and it's actually a really high percentage. I'll need to answer that in the blog post because I don't know off the top of my head, but the beginning of each survey does let us know how many students took that. So, and if anybody else has that answer, Bethany or Kat or anybody else, feel free to just type that in the chat. I'm not actually able to see the chats without stopping what I'm doing. So, and Allison, if you're seeing something of interest in the chat, do feel free to unmute yourself and ask that. So, so then we skip over to high school last 30-day use, and we do see a dramatic increase from middle school for sure. And if we can break this down. This is kind of the high level data. When we break this down by grade cohort, we see that, you know, the ninth graders are at the lower end, and then it starts to actually increase by the time you get up to those junior and senior year. That's just kind of a transition time, and we start to see a spike in use. So the average is not across the, you know, it's not equal across the board. So alcohol use has declined a little bit, down to 33%. Binge drinking, we're at 16% of our youth. Cannabis use is 28% of our students have used in the last 30 days. Tobacco, and this particular tobacco in question for high schoolers also does include vaping. So we see an increase there. So that has gone up to 31%. And prescription drug misuse is 5% in the last 30 days. And then when we start to look at perceptions. Yep.
Jessica, there was a question about, is this data just county or school-based? And so this data is Lamoille County based. I'm going to put a link in the chat in a minute that it's a link to a lot of data, and you can see some of the other counties in the Lamoille Valley, but each school and school district does receive their own data. And so if you want access, I think it's best that you ask them directly. Other folks, I mean, we have representatives who might be able to answer that better than I, though, here.
Yes, and I have heard that this year there might not be the school specific. It might just be by school district, just due to the staff being pulled in lots of different directions due to COVID. So, but that was what we heard most recently. So thank you, Allison. Are there any more, anything else happening in the chat that I should be aware of? Nope. Okay, good. And I apologize. This is a lot of data to digest at once. We will be sending this out to each of you, so that way you'll be able to look at it. We're also happy to meet over a virtual cup of coffee and discuss any of these numbers. This is kind of just an intro, what are the trends, and we'll be using this data in upcoming meetings as well. So, so then the next area of data that we get into is around perceptions. So this question asked, you know, do you think that your parents think it's wrong for youth your age to use these substances? So looking at that parental perception, and we know that when youth get strong messages from their parents that, you know, substance use is not okay, that those youth are less likely to use. So this really is one of our protective factors. So we want to see high numbers in this data. And so we actually are starting to see some encouraging trends. So for middle school alcohol, 89% of students now feel that their parents would think it was wrong for somebody their age to drink, up from 84%. So this is an encouragement. And then for cannabis, it's 89% as well. And then vaping, they stopped asking about tobacco in general and just switched it to vaping. 93% of middle schoolers think that their parents would think it was wrong for them to use. So this is encouraging, and we need to keep up the work here of, encouraging parents to have these messages often with their kids. And parentupvt.org is a really great resource for parents to be able to learn how to have these conversations, because they can be kind of uncomfortable. So how do you have those conversations? And then when we skip over to high school, we do see an increase as well in alcohol, that parents, high schoolers think their parents would think it was wrong. That's at 65%. So not as strong as the middle school, and not as strong as the state. So there's definitely still some work to be done there. Where we do see a decrease is in the cannabis, the marijuana, from 73% down to 69%. So just as it's become more acceptable, people either are not knowing how to have those conversations or believe that it's something that you grow, so therefore it's not as harmful. But so there's a lot of work to still be done there. And then vaping, this is interesting because 90% of high schoolers in 2017 thought their parents thought it would be wrong for them to use tobacco products, but only 81% their parents think it would be wrong for them to use vaping products. So that's just a really, really interesting trend as well. So Allison, is there anything in the chat on this slide? I see it blinking. So
I was just letting Suzanne in. Welcome, Suzanne. And also just comments, like Kat was mentioning, just thinking these numbers are going to drastically change for the worse given the pandemic. And I think that, in the schools, Jessica and Kat and others can talk about the core measure survey and other ways that we're trying to keep up with the present time.
Right.
This is dated.
Great. Yeah, great point. So part of our drug-free communities grant is that we're able to, or we're actually required to, but the timing of it is really good, is to do a core measure survey. So we look at the 4 substances. We look at last 30-day use, perception of harm, parental perception, and I think there's one other indicator there. And so we're able to get kind of a real time, and Lamoille is doing that, or is in the process of wrapping up that process at the high school, and People's Academy is getting ready to launch that in I think the next week or so. So it just kind of gives a glimpse, and that's not data we're necessarily going to share out, because the YRBS data is data that's been sent to the CDC, and it has a lot of the measures put in so that it's really well vetted data. The core measures data is really helpful on the local in-school level to help school staff know, what's going on, what are the trends that may be happening, so they can be super responsive to student needs. So that's one way we're able to collaborate right now in this time. So, and then the next area is also still around perception, and it's young people thinking that they risk harming themselves when they use these substances. And there's a lot of work to be done here for sure. So only 49% of middle school students think that they would cause themselves harm if they drank alcohol or drank, I think it was a significant amount of alcohol, if I'm remembering the question. And then when we look at cannabis, it's only 46% think that it's harmful. So these numbers are really low when you think of, these are 11, 12, 13-year-olds, that tend to, they still, their worldview often is that, these substances are bad. So for them to not think that these things are harming themselves, there's some work to be done there. And then again, the questions shifted from tobacco to vaping, and we see a really big drop. The youth just are not thinking or seeing these devices as harmful. And again, this was before they hit national news with the lung issues. And then we skip over to high school, and those numbers go down again. Only 37% of high schoolers think alcohol used regularly would be dangerous. 18% for cannabis, and 28% for vaping. So there's a lot of work here to be done around perception of harm. So, Allison, is there anything in the chat?
I think we're good. Just people talking about how the pandemic has fueled substance use and financial stress. There's lots going on in the community right now.
Yeah, and for sure, I think we're going to start to see more, and we need to be responsive to, getting creative education out around substance prevention, but also watching mental health issues. And I know our schools are working really hard on that. So
yeah, we have here just also about how parents' influence or parents' perception of harm is directly correlated to youth use or increased youth use, and just seeing how those trends play out.
Yes, for sure. So, and Michelle has these great graphs, and I don't have them for the 2019 data yet, but as parental, perception of harm goes down, we actually see an increase in youth use, and it's really staggering when you see those two graphs overlaid. So yeah, so good. And then the other risk factor is ease of access to substances. The more it's available, the more likely youth are to use it. So, and so this tells us these are youth answering these questions. So it's their perception of how easy they think it is. So for alcohol, 47% of our middle schoolers think that they could easily get alcohol if they wanted it, as opposed to 40 at the state level. For cannabis, 23% versus 19, and then vape products, 33% versus 29 at the state. And this really, we can start to address this by addressing, education towards parents of like, how do you store the substances that are in your home? They may be legal adult use substances, but they're not legal for anyone under the age of 21. So how do we do some work around, lock the stuff up, monitor it, if you have it. So, and then when we skip over to high school, those numbers jump again significantly. 70% of our youth think that alcohol is easy to get. And then the survey also breaks down where youth are getting it. So if you like data, we're going to share the link at the end, so you can really kind of dig into these numbers a little bit more. For cannabis, 68%. This is a 10% increase in 2 years. So even without the commercial markets in place yet, just starting to make it legal for home use, we saw a 10% spike here. And then vaping devices, we can see that they're a lot more accessible to high schoolers than middle schoolers. 76% think it would be really easy to get a vaping device. And Allison, anything from the chat?
Some ideas about campaigns, and Maria wrote, can we put out a campaign to say, do not give your youth a general gift card for the holidays? They could, be buying vaping devices, just ways. I think educate. We actually, I should just put out there now that one of the work groups that is a subcommittee of the Tobacco Prevention Task Force that we're launching is a youth vaping prevention task force. And I think that, the numbers here definitely show here, even in the ease of access, it's easier to get a vape. In 2019, it was easier to get a vape, perception was easier to get a vape device than cannabis or alcohol to get your hands on vaping. So folks can be thinking about that. It'll be a community-wide, all ages task force to really work on this topic.
Good. And I do want to be mindful of time. So we're gonna kind of, whoops, I stopped screen sharing. Sorry about that. That was not my intent. Okay, so we start to get into the protective factors, and we're not going to go through each of these just because of time, and we want to see the students' photo voice and honor our prevention honorees. But basically, when we look at, we have risk factors, and we just looked at those. And then we have protective factors, and protective factors are those things that when we, are active and vital in the life of an adolescent, that, they're less likely to use substances. So, when we look at the physical activity here, we see a decrease. Dinner at home, at least 4 days a week, it's those connection points of relationship. One teacher or adult that they can talk to. There's just kind of been a dip. Schools having clear rules and expectations and consequences for behavior. So looking at school policy and then feeling like they matter. This last one is one that I always love looking at, and I know that there's a decrease here, but when young people feel like they matter to people in the community, like that people care about them, it just improves their overall sense of well-being. And it's such a simple fix. It's not like the only fix, obviously, but it's something that doesn't cost money. If everybody just kind of like reached out to the kids that live around them, got to know their names, ask them about school or sports or, band and music and art, hired them to do, rake the leaves, just like, simple things that you can build a relationship with the youth that are in your lives and help them to feel that they matter. It's just one of those really simple things. And then when we look over to high schoolers, the data is similar. So 46% are physically active 5 or more days. 74% are eating dinner at home. 76% have a teacher or adult that they could talk to at school. And then this next one is kind of concerning, that only 44% feel like there's clear rules and consequences for behavior. I think, as we seek to give, more freedom to our, kids as they get older, sometimes they lose that sense, and we don't want things to be punitive, certainly. So that's an area that, we can do some work around. And 57% feel like they matter to people in the community. And then this one also has the indicator of the question asked of probably or definitely complete post-high school plans. So that could be a tech program, that could be college. There's some different avenues there, and we have 73% there. So that's really the YRBS data. So I kind of sometimes will geek out over this a little bit, and I thank you for bearing with me because that's a lot to throw at you at once. But we did want to, the next step, or the next thing we're going to do, youth voice is super powerful in anything. When youth get excited about work, and people stop and they listen. And because youth are, not just our future, they're also our now. And they see things from a very different perspective than we do. We sometimes will close, have a kind of a blind eye to things. And so we put it out there for some of our youth. Well, we put it out there for all youth to do a Photovoice project. This was one opportunity for them to share their voice, and we've actually extended this opportunity, just recognizing that with the start of the school year, things kind of got crazy, and so, the opportunity to focus on something. So this will be going until we have actually 20 youth participate, and right now we're at 3. So we asked youth to identify where they see mixed messages around substances in the community, and then to highlight data. So we actually have 3 youth on the call, and I'm going to put their images up and ask them to unmute themselves. And they're just going to share just a little bit about this. And we're just going to go, in order, and they don't have to talk long. But so the first one is Nate.
Hi, yeah. So the story behind this image I found is sometimes we'll be going through Morrisville and there's this Mike's Hard Lemonade truck, and it says delivering happiness to Vermont. And we know that alcohol is a really large issue and does not give you happiness. So I have the Society Sends Us Mixed Messages, which is kind of the theme. And some stats. So I have the 60% of the high schoolers in 2019 had ever consumed alcohol. 70% thought it would be easy or very easy to access it. And only 50% thought that it would be wrong or very wrong to consume it. So the perception of harm is pretty low there. I want to have a little bit about what society tells us, and then, sorry, hold on, there's some stuff happening in the background. So yeah, that's it.
Good. Thank you, Nate. So good. And then Cassie, and Cassie sent us two pictures. So this is our first image.
Yeah, so the photo shows signs of beer, and there was also like wine bottles next to the ice cream cooler. And this is a mixed message because kids love ice cream. It's like one of their favorite desserts. And they put alcohol right next to it, which makes it seem like alcohol is okay to kids too. And then my fact was 14% of 8th graders said they currently drink alcohol compared to 5% of 7th graders. Yeah.
Awesome. And Cassie really went above and beyond and dug into the breakdowns of the data, because the YRBS breaks it down by grade as well. And then this is her second photo.
And this photo is showing signs for a grocery store and a liquor store. And this is a mixed message because kids and families go into the grocery store and it makes liquor seem just as necessary as the items you find in a grocery store. And in the specific store that this picture was taken at, the two stores are actually connected. So that made it seem like even more okay. So, yeah.
Good. Thank you.
Unmute.
Thank you, Cassie. And then Ellie, this is another grocery store picture.
Hi. Yeah, so I chose this picture because Powerade is a common beverage with a lot of the athletes. Sports drink. And Citizen Cider is also, it's alcoholic. So my data point is 10% of middle schoolers claimed to have tried alcohol before the age of 11, which is very relevant to me because I'm 12. So yeah.
Yeah, and so we took all of these messages and we paired them, in a format that also gives a message to the parent at the bottom. And that one is monitor alcohol in your home and teach kids the risk. And we know that for so often coolers mix, alcohol and youth drinks in the same one. So Allison, I'm seeing some action in the chat. So
people are really liking seeing the youth involvement and what the youth lens to this. I think it's so valuable that each of you did these incredible photo voices, really highlighting mixed messages, and your voice really speaks louder than ours. You probably know that, but in the community with peers as well as with adults. And so I'm looking forward to how these get out in the community.
Good. Allison's also going to share some ways that you can get involved. We've shared a lot of data tonight, and you may not be ready to sign up for anything just yet. But it's good to think about okay, how do I make change? And so, we sent everyone this this graphic that kind of it, but Allison's going to also share it a little bit. So.
Great. Thanks, Jessica. Hi, everyone. So as many of you know, Healthy Lamoille Valley, we work on an outer community systems kind of level. And so not only are, we saw the data, there are data that are concerning, there's risk factors and protective factors. A lot of the work also is looking at community risk and protective factors on this outer level, and what we can be doing, not just in the schools, but also in the community, in the retail environment, organizationally. So we're really a growing coalition with so many different sectors, different groups of people with all different identities who are connected, and are so glad to have you all here who some in varying degrees of involvement thus far. But just so that you know, you can see here, there's so many ways really to get involved. There's going to be a survey that'll come to you in a few minutes, but whatever your interests are, or your skills, talent, experiences, how you can fit in, what you care about most. We have lots of work groups, some in particular that I'll just highlight. We're starting a cannabis work group, especially with commercialization and legalization right now and moving forward. We're connected with Prevention Works, which is a statewide like umbrella organization for all coalitions, but we're doing a lot of work locally and starting to think about, okay, we need a group of people to really think about the Lamoille Valley in particular, and what are our specific concerns and what can we do? So that's one very timely topic. I mentioned already the work group on youth vaping prevention, which you may be interested in. But on the other hand, there are project-based work groups that meet more frequently or less frequently. If you're really interested in data or media, social media, there are just so many ways to get involved. And I know that in the survey, you can, if you're even thinking about one more way you would like to contribute, let us know. And if it's not on the list, please let us know, because we haven't thought of everything. We need you.
We do. And that's the beauty of coalition work. We have 4 staff, but staff can only do so much. We only have so many relationships, but all of you have connections and gifts and talents, that you could use. And it might take you an hour a month to do something, but it's not where Allison and I can go. Like, we don't have those connections. So anything that, way you can tie in is awesome. So thank you. So yes, we'll be doing a survey briefly, but we also want to recognize some people that have done incredible work. Our coalition has actually been around for almost 20 years, but this is the first time we've actually done prevention awards. We really recognize that we need to celebrate our work. And so there's a couple things that are going to happen. First of all, I'd like to congratulate everybody because you've been, a part of this work. And our coalition, as many of you know, is a drug-free communities grant. The first year of the drug-free communities grant, we're required to do the National Coalition Academy, which is 3 weeks of training and a lot of kind of legwork looking at logic models and data and creating a community assessment. And we actually just got word the end of last week that we are ready for graduation. So that's a super huge accomplishment as a coalition, and you all played a part in that. Even if you don't think you have, just showing up, having conversations, scheduling a meeting to learn more, that's awesome. So thank you. But we also want to recognize and celebrate some people that have been involved and been pretty special. You're all special, but have gone and done amazing work. So the first one I'd like to recognize, and you can just kind of give a wave, we're not going to ask you to speak, is Andy Tisdale. Andy has been involved with Healthy Lamoille Valley since her 7th grade year. She was one of our first cohort of youth and has still been involved and has done amazing things during that time. She's gone to the CADCA conference, the Community Anti-Drug Coalitions of America conference down in DC with us twice. She's been an actively involved in her schools, Getting to Y group, which is a school-based prevention group where they look at their data and the students invite classmates in to look at their data. And this is a super dynamic process. She's been involved with VCAT and OVX. VCAT is Vermont Kids Against Tobacco. And back to the Getting to Y, she became a Getting to Y state trainer and helped that organization and that initiative become recognized as a nationally recognized initiative within the last year. So that's a tremendous amount of extra work Andy, we appreciate you. And Andy is now in high school on the school leadership board, and I'm sure making some great changes there. So we decided to not give you another plaque or certificate, but I've actually been doing some pottery, and so we have a hand-thrown bowl for you. So whether it's cereal or soup, we thought that might be a little bit more special than something to just hang on the wall. So thank you, and we appreciate all the work that you've done. So the next person we want to recognize is Suzanne Masland. Hopefully she's still here. She is here. And Suzanne was our district director for the Department of Health, and she retired in the spring, and we miss her. She was a steering team member for us, as well as the chair of our steering team for a long time. And when Suzanne came in, she really just kind of reached out to a lot of different organizations around the region. And then she really got prevention to the table at a lot of tables that we weren't at, you know, connecting better with the medical community and just, you know, really advancing our work and thinking about it differently. And another thing that Suzanne did was she really helped us with our drug-free community grant. There was a period of time, I think we were meeting weekly in her office preparing our application, and she read the application, she chewed through the data with us, and really, you know, one of the reasons that we have this grant is Suzanne. So Suzanne, we have a bowl for you, and thank you for your work in prevention. So
Thank you.
The next award goes to our community prevention champion. And this award goes to the North Central Vermont Recovery Center and Director Daniel Franklin. As Daniel says, recovery is prevention. So all of those families, and they've been working so hard to expand the work, and it's been really exciting to see just them expand their reach, but also bringing prevention along to many of the conversations. Like, he recognizes that it's all interconnected. He's currently serving as the chair of our steering team, and you know, he's very prompt at returning emails, which is awesome. And the Recovery Center has also gone above and beyond. They became a gold level partner for 3-4-50. This is a state initiative that looks at 3 behaviors that lead to 4 diseases that lead to 50% of the preventable deaths among Vermonters. And Daniel really, you know, he and his team like started to analyze what's going on at their, you know, their facility, and how can they make it better and more welcoming and really promote health. And they started doing some meals that with healthy foods. They planted a garden, you know, they have these beautiful raised beds out in the yard, you know, they, you know, I think it's friendly to nursing moms, and, you know, so they just like really started looking and just kind of took it and ran with it to a higher level. And it's just super exciting to see that. And so they are our model for many of our organizations. So, so congratulations to Daniel and the Recovery Center. And Crystal is on the call too. Welcome to the Recovery Center family. The next one, we have 2 left. The next one is the Business Prevention Champion, and this goes to Riverbend Market. Tim was not able to join us. Riverbend Market in Morrisville has been an ongoing partner for really as long as I can remember. One of my first, I've been around for about 6 years with Healthy Lamoille Valley. One of my first experiences was outside. He was a healthy community partner, and we were doing surveys of customers, and he was giving a cup of coffee. And they had just had a mural painted. They had this big beer advertisement banner above their cooler. And so Tim worked with Healthy Lamoille Valley and had an artist come in. And so it's this beautiful mural of life in Vermont and how to be active and healthy. And it's just really neat to see that up there. But he continues to partner. This spring, we did Sticker Shock for the first time in a long time, where we had youth go in, and they had these little stickers that they put on bigger packages of alcohol. And it just reminded people around graduation time that alcohol was not for youth. And so, and he was a willing partner with that. He's partnered with us on retailer outreach around best practices, the retailer connector, as well as being a regular for coffee sleeve distribution for the Parent Up campaign. So he's just kind of been a regular. And on top of all that, he has decided as a retailer not to sell vape products because he knows that they're, you know, so often attractive to youth, and he didn't even want to go there. So, so if you get to go in Riverbend Market, say hi to Tim and congratulate him on his work in prevention, and thank him for being a prevention partner. And last but not least is the Lamoille North Parent Series. We have both Bethany and Kat on the line. Last spring, Bethany reached out and said, hey, we'd like to do a parent support group. There's such a need with COVID, and what can we do? And we started brainstorming, and it was really like synergetic and really exciting to see a community partner identify a need and then make the connection. So we met for 7 weeks over the spring. The school provided staff to run the breakout groups, as well as we partnered with Lamoille County Mental Health, had a couple of clinicians on in each of those breakout rooms. And then we had additional community partners come and give a 10 to 15 minute presentation. And then we broke into those breakout rooms. So it was really an extraordinary effort, and it was really exciting to be a part of. And thank you. It looks like maybe Bethany had to hop off, but thank you, Kat, to you and your team for allowing our partnership. And that continues. We have the Live Your Why campaign this fall, and it's just promoting healthy behaviors. And they've been a partner in that. And in fact, their food services is doing some after school programming that we've been able to partner and potentially get some after school activities into the home. So thank you for being a great partner there. So thank you to all of our 2020 prevention champions. You know, I think hopefully this will be a tradition that goes forward. So we're super excited about that. A couple of other things super briefly, and then I want to let you go because it's 59. Next month, so we've started a new format, coalition meetings. You know, if we're going to invite people to be involved, there has to be a time that people can kind of come to. So we've chosen the first Tuesday of each month in this time block, 6 to 7. And next month, we're going to be looking at the prevention primer or toolkit. And oops, I'm trying to do two things at once. And this prevention toolkit, Allison, can you share about this and give a teaser for next month real quick?
Yes, and I also just put a link in the chat box for just rolling it out. Healthy Lamoille Valley had, before it was Healthy Lamoille Valley, had a grant to create a primer for prevention, looking at how towns and municipalities could really make an impact on youth substance prevention. And I used that document a lot, and then realized what we really need is to update it and to turn it into a toolkit and something really accessible for community members. I just want to get Bethany back in here. For community members, for town leaders, for municipal staff, as well as elected officials. And planning commissions. So this document we worked on in collaboration with community partners and also youth, and I really am looking forward to getting it out there. It takes a look first at what youth see in our communities, where youth see substances in our communities, really practical, helps us to kind of think about where do we see substances in our communities, because it's not just, the work is not just about in the homes, right? We're talking about what the community norms are and how we can, how we can change those towards healthier behavior. And looking at access and availability, all of these risk factors, but how can we reduce the risk factors and increase the protective factors? And so this is a new tool. We're looking for how to use it, with different ways. So once you take a look, any suggestions would be great. And I did put a link to the online version, but we also, and it's in the survey, are happy to send you hard copies. And we're partnering also with many of the libraries locally. Well, they will have hard copies for people to pick up. So just, we can't wait to roll this out and with your support.
Awesome. Welcome. And Bethany did join back in. Congratulations, Bethany. I know you missed part of that. And thank you for initiating the Parent Cafe series. So, so that we just put the survey link in there, and that's also the request for the toolkit. And thank you all for coming. We do want to honor everybody's time and let you out, well, 2 minutes late. We're going to stick around for a couple minutes, so if you have more time and want to chat, but we'd love to connect with you and love to empower you to reach out to your community circles. So thank you so much, and be at peace tonight, and drink a cup of tea and breathe deeply, and yeah, it'll be an interesting evening. So thank you for being here and making us part of it. So.